Bismillah ar-Rahman ar-Rahim. I'm Dr. Mohibullah Wazir. Today we discuss the nerve supply of the esophagus. Esophagus consists of the cervical part and then this thoracic part and the lower distal small part in the abdomen or abdominal part. The upper part of the esophagus, it is having skeletal or striated muscles. That's why this upper part of esophagus is supplied by a branch from the vagus through the recurrent laryngeal nerve. These fibers are coming from nucleus ambiguous and which is motor for the skeletal muscles of the upper end of esophagus. That's why the upper end of esophagus we can contract voluntarily to push the bolus of food quickly and with the force to the lower part of the esophagus. While the upper part of esophagus is also supplied by sympathetic fibers coming from the middle cervical ganglion of sympathetic chain, and these fibers are vasomotor and also the afferent. Then the middle third and the lower part, the middle part and the lowest part in the abdomen, it is supplied by esophageal plexus, which is formed by sympathetic fibers coming from the thoracic sympathetic chain and from the greater splenic nerve. The greater splenic nerve is also a branch of the sympathetic chain which descends downward, passing through the diaphragm, enters into the abdomen, do not relay in the sympathetic chain, pass unrelayed and relay over here in the celiac ganglion, and from this then fibers passes along the celiac trunk artery to reach to the lower end of esophagus as well as to the stomach. And the the parasympathetic fibers are coming from the right and left vagus nerve, which the two nerves right and left, it make a plexus over here in the over the esophagus to make a parasympathetic plexus, and from then onward two nerves are again found, which is one passes anterior to the esophagus, which is now called as the anterior vagal trunk and posterior vagal trunk instead of right and left vagal nerve. In this way, the middle and the lower part of the esophagus is supplied by autonomic, that is sympathetic and parasympathetic. Parasympathetic is coming from the vagi, right and left, and then the lower part from the anterior posterior vagal trunk, while the sympathetic is coming from the thoracic ganglion as well as to the lower part below the diaphragm. It is coming from the greater splenic nerve through the celiac ganglion. Postganglionic fiber coming from the celiac ganglion. The parasympathetic is again motor and secretomotor. Motor for the muscles, the lower part which consists of smooth muscles, the upper part consists of skeletal muscles, and motor for the smooth muscles, secretomotor for the gland, while the sympathetic is again secretomotor. It is vasoconstrictor for the smooth muscles of the blood vessels, and also sensory, said to be as the pain fibers are running in both, but most it is said that the sensory or afferent fibers are being the sympathetic, they are afferent in nature and carry the pain sensation. Okay, like the cardiac pain, the heart pain, because the esophagus is supplied by the cervical ganglion as well as from upper thoracic sympathetic chain. That's why the pain of the esophagus is also being referred to the thoracic vault and then to the root of the neck and also to the shoulder. So may not confuse it. You may not confuse it with the cardiac pain, but you should make it clear that it may not be the cardiac pain. And but it is said nowadays that pain above the umbilicus is the cardiac pain unless you prove otherwise. This is about the nerve supply of the esophagus. Thank you.